common ailment that brings children to my clinic are skin rashes. There are quite a number of skin rashes, but I want to talk specifically about eczema and psoriasis for the moment. These can be very frustrating ailments because there seems to be no cure. Visiting the family physician gets a prescription for steroid creams or other suppressive medications, but there seems to be, other than that, very little to treat the underlying cause. And I would like to say that there are a number of ways that we can look at the underlying cause and get these patients to a much better, long-lasting state than using the suppressive medication. In particular, we want to look at the gut. We feel that the inflammation in the gut is a key to that systemic inflammation, which in these children is expressed in the skin. My starting point is often to have an assessment for food sensitivity. We're not looking for a food allergy, a type 1 allergy that has an immediate response, perhaps can even be anaphylactic. But there are other forms of hypersensitivity, and we look for the delayed reaction to food as a fundamental problem with these inflammatory conditions. So it's a simple blood test which checks for the antibodies for delayed sensitivities to food. We also need to look at inflammation in general. So that means we want to evaluate this child's ability to produce anti-inflammatory molecules based on the proper nutrition and the proper building blocks that they would manufacture these anti-inflammatory chemicals from. We also want to include the importance of the healthy gut. We see, as time goes on, more and more headlines in all the newspapers and news articles and television news programs saying, oh, the microbiome and this disease and that disease. And any of the inflammatory conditions now have very well researched and documented relationships with the microbiome. And we have a number of tools at our disposal to evaluate the patient's microbiome and the quality of their digestion, as well as being, as a naturopathic doctor, being well versed in how to help improve a person's microbiome and the quality of the digestion. We want to minimize the inflammation that comes from poor digestion. So that's a condition where we really are able to offer complementary and supportive help to what these children may be receiving already